Before going into marriage, you must know your genotype and your partner's genotype. So in this video, I'm going to be talking about genetic combination and a little about sickle cell disease. This video is dedicated to all sickle cell patients around the world. We have 5 examples of genotype in different humans' body. The first one is AA, the second one is AS, the third one is AC, the first one is SS, and the last one is SC. Genotype and blood groups are inherited from our parents, and because we did not get the chance to choose the type of parent we want, some of us are given birth to with sickled cell. So in this video, I'm going to be showing you the genotype that are not compatible and the one that are compatible. I hope this is clear enough for you to see. The AA and AA is a goal, that is, it is recommended, and this is because both are not carrier of sickle cell disease. It is approved. So if your genotype is AA and your partner is AA, you are good to go. So AA and AS can get married. This is because AA is not a carrier, but AS is a carrier. But because AS is a carrier, this AA can in turn help the AS. Now, AA can marry SS. This is a carrier. We all know this is a carrier. This is a patient with sickle cell from both parents. This is a patient with sickle cell from one parent. So this does not have any sickle cell, while this has 2 from both parents. They can marry, but they will in turn give birth to AS. AA and AC can marry. Now we have AC, but people tend to know more about the SS. We also have AC and we have AS. Now AA can marry AC. AA do not have any sickled cell attached, while AC has 1. But because AA do not have, AA can help AC. Those are the recommended one. Now, the one that are not recommended, AS cannot marry AS. AS has 1 sickled cell attached to he or she from one parent, while this person also has a sickled cell attached to the body from another parent. If they should get married to each other, they would give birth to a child with sickled cell. Not 1 sickled cell, but they will give birth to a child with 2 sickled cell, which is SS. Now, AS cannot marry AC because both are carrier. When they get married to each other, they would have SC, which is a carrier. The child will get S from one parent and also C from the other parent, because it is the combination of genes from both parents. Now, AS cannot marry SS, and that is because this is a carrier and this also is a carrier. This has 1 A from one parent and S from another parent. This has S from one parent and S from another parent. If they should give birth to, if they should get married to each other, they are going to have sickled cell children. AC cannot marry SS. They are both carrier. This has 1 A from one parent and also C from the other parent. This one has S from one parent and S from the other parent. If they should get married to each other, they will end up having sickled cell children. Now, SS can never and should never marry SS. These 2 are carriers. This one has sickled cell from one parent and another sickled cell from another parent. This one also has the same, and when they get married to each other, they will have sickled cell children. So take a look at it. If you need to screenshot it, please do. Make this information go viral. Please, if you're yet to subscribe, please subscribe to this video. I promise you there are a lot of educative content here for you guys to watch. What results in sickle cell disease? Sickle cell disease affects the hemoglobin within your red blood cell. Now, abnormal hemoglobin comes together and cause the red blood cell to turn to a sickled shape. Instead of it to be a round shape, it will be a sickled shape. And this is, if something is round, so something can easily pass through it, right? It can pass underneath. But once it's in a sickled shape, this thing that looks like a tail blocks oxygen and also some nutrients from going to the entire body, which can lead to crisis in sickle cell patients. So type of sickle cell patients, we have the HBSS. This is the severe form, and we have up to 65% amount of people under this condition, and this is as a result of generating hemoglobin S from each parent. Now, when I said when AS and SS get married to each other, the child will generate A from one parent and S from another parent, which will result in AS child. And a child can also generate S hemoglobin from one parent and S from another parent, which can result in a sickle cell child. So this is what results to sickle cell patients. The second one is HBSC. So this one is a mild form of sickle cell disease, and we have up to about 25% suffering from this condition. Patients inherit hemoglobin S from one parent and hemoglobin C from another parent. This can be as a result of AS and AC getting married, or AC and SS getting married. The child can inherit hemoglobin S and hemoglobin C from each parent, and this hemoglobin are the abnormal hemoglobin. It can result in SC child. What are the signs and symptoms we are going to notice in a patient with sickle cell, or even if you are a sickle cell patient? The first one is anemia causing fatigue, weakness, and paleness. I'm going to explain how this can lead to complication. The second one is frequent pain episode, painful swelling around their hand and feet, and jaundice. Jaundice is a condition whereby the skin begins to get yellow, their eyeball and some whitish, or maybe their palm everywhere begin to get whitish. Complication. I mentioned anemia the other time. I said anemia can cause paleness and weakness. So anemia occurs when there is no healthy red blood cells to carry nutrients and oxygen throughout your body. The red blood cell in AA's body and AS body use up to about 120 days before they die. But in sickle cell patients, that is the SS and the SC, they die very early. They use up to maybe 10 to 20 days. When this keep occurring, it can lead to loss of healthy red blood cell in their body, thereby leading to anemia. Pain. Now, I said the cell is like a sickle shape, which blocks the passage of healthy blood. It blocks the passage of oxygen and also some nutrients around the body. So when this scenario occurs, when the sickled cell blocks the passage of these nutrients, it causes pain. It's just like maybe when a part of the erosion is blocked and water could not flow easily. It can lead to destruction of land and property, because it will start finding its way to get out. So when nutrients and oxygen cannot get to other area in the body, the scenario that happens leads to pain, and it is also called crisis. Acute chest syndrome. Now, when nutrients and oxygenated blood cannot be transported throughout the body, it would not get to some part of the body. Some part of the body will suffer for it, which the chest is also involved. So when this crisis occur, it can lead to acute chest syndrome. It can also lead to lung injury and difficulty in breathing. Organ damage. This occurs when there is no sufficient supply of blood and other nutrients to the body. Organs like kidney, liver, and the heart may fail when they do not get what they need for their normal functioning. Sickle cell in the penis can lead to persistent painful erection, which can also cause erectile dysfunction and permanent damage. As a sickle cell patient or someone who just wants to know about sickle cell patient, there are some things that can trigger the activation of the sickle cell in the body, and their triggers. Triggers include dehydration. These are the things that can cause, let's just say these are the things that can cause crisis. So we have dehydration, stress. This can be emotional stress, psychological stress, physical stress, malaria, extreme cold, hard drugs, alcohol, low oxygen, which can be as a result of strenuous exercise. When you engage in strenuous exercise, it can also result in triggers and also menstrual cramps. How to prevent crisis? You have to avoid the triggers. If you know exercise triggers your crisis, then you have to do away with that. If you know cold water or cold environment triggers your crisis, then you have to do away with cold environment or anything that is cold and can affect your health at that particular point in time. Avoid mosquito and always be hydrated. Treatment. The first one is pain management. Support, emotional support. Even if you are not a health provider and you don't know what to do at a point where a sickle cell patient has crisis, you should be able to provide emotional support, reassure them, let them know they'll be fine, let them know everything is okay. It's not that you just be talking to them anyhow as if they intentionally caused that. Okay, keep them warm and also blood transfusion. There are other inventions which involve bone marrow transplant. That's all about this video. I hope it was helpful. Please give this video a like, comment, share this video with family and friends. I have a lot of educative content on my channel. If you're yet to subscribe, I hope you do so now. Get in touch with all my previous videos and follow me on my social media accounts. I love you so much and God bless you.